friends around the world. So I've been getting a lot of requests for information about coronavirus. And I thought rather than sending everyone individual messages, it might make more sense to just make one video that you can watch or share or do whatever you want with. So here it goes. So I know it's some pretty crazy times right now. I think the most important thing to keep in mind is rule number 2 from the Hitchhiker's Guide to the Galaxy, which is don't panic. And I'm hoping that by giving you some information that is fact-based, that might help you to feel like you've got a better understanding about what's going on right now. So a lot of you know that I have a master's degree in public health. I'm also doing a PhD at the University of Edinburgh in global health policy. I'm president of the Society of Practitioners of Health Impact Assessment, and I sit on the advisory committee for the World Health Organization Collaborating Center on Investment in Health. So all that's just to say that I do have some level of expertise in public health. And I know there's a lot of misinformation going around right now, getting text messages from this friend of a friend who works at the government or works at a hospital. And what I thought I would do is to try to give you some information that is actually, based on facts rather than theories or rumor. I'm not an epidemiologist, to be clear on that. I don't do work on emergency preparedness. But my background in public health does give me the skills to be able to read information as it's coming out from reputable sources and scientific journals, and to be able to interpret that information. But I will say that nothing I'm going to say to you is like my opinion. It's everything that I've been reading from other really reputable sources, like the World Health Organization, or the University of Washington Institute for Health Metrics and Evaluation, or the Centers for Disease Control. So here we go. So to make sure we're on the same page, let's go over some basics. So what is COVID-19? So COVID-19 is a new type of coronavirus. Coronavirus is a group of viruses that can cause everything from the common cold to other illnesses. First case of COVID-19 appeared in Wuhan, China on December 31st, 2019. It then quickly spread to countries around the world like the US, Australia, Sweden, places where you all are watching from, and here in the UK as well. Those were all occurring around early March 2020. So how quickly is COVID-19 spreading? So COVID-19 is transmitted through aerosols, and aerosols are droplets of fluid that contain the virus. These are then spread by coughing and sneezing, and new research is even finding that those droplets can be aerosolized through even talking. So these aerosolized particles can remain viable in the air for up to 3 hours, or meaning that they could infect a person hours after being expelled. They can also remain on hard surfaces for several days. So this has led to a rapid spread of the disease. It's at an order of about 2.4 people infected for every 1 person who is sick. So this high level of infectiousness and the fact that it is spread through these droplets of fluid is the reason why we've seen this rapid and exponential spread of coronavirus around the world. So what are the different interventions that are being used to slow this spread? Well, given that there's no actual prevention of transmission, such as a vaccine, or there's no type of cure, the best thing that public health officials can do is to slow the spread of the disease so that those who need medical attention can receive it. And this is what's being called a flattening the curve. I'm sure many of you have heard of that. It's the idea of reducing the amount of contact that people have with each other so that the disease can't spread as easily. If you're interested, there's a really great visualization of that kind of spread from the Washington Post, and I'll send a link to all of you for that. So governments around the world have taken varying approaches to reduce the amount of contact that people have with each other. So that can range from everything from a full lockdown, such as what we're currently doing right now in the United Kingdom, to more moderate approaches like what Sweden has done, which is to keep businesses open, but request that people do social distancing, and that is minimizing the amount of contact that they have with each other. Countries like Australia have even gone so far as to shut their borders. Are these interventions working? Well, we think so. So current modeling from the University of Washington predicts that the number of cases of COVID will peak within the next few weeks for countries that have enforced some form of social distancing. So the peak is predicted for the US on April 13th. In the UK, they're predicting that the peak will occur on April 18th, my birthday, woo, and in Sweden on April 25th. A word of caution about modeling though, any of the predictions you see that are going to happen are based on epidemiological models. Models are scientific, they are mathematically robust approaches to understand future outcomes based on current data. However, models only ever give us a likelihood of what will happen within a certain confidence interval. And that confidence interval means that the actual outcome can vary, sometimes quite drastically, from the outcome the model predicts to be the most likely. They're also limited by the fact that they have to use whatever data is currently available, and a lot of the times the data is not perfect. So, these predicted peaks are a good thing to take into consideration, but bear in mind that might not end up being exactly what it looks like in reality. So what should we all be doing to stay safe? You should follow the rules set out by the governments in which you live. I understand that these rules are not always well communicated, and they're called different things, everything from a lockdown to a shelter in place to social distancing. So it's important that you look for the information around what your local government is telling you to do. So just to make clear a few things, a lockdown or shelter in place means that you should only leave your home to buy essential goods like groceries, to receive medical care, or to go to work if you are considered an essential personnel and you can't work from home. Social distancing means avoiding all unnecessary social contact more generally. So avoiding public gatherings, staying home, using a tap and go instead of cash, and always keeping 2 meters or 6 feet away from another person. You should also always be washing your hands anytime you touch anything out in public, washing hands for 20 seconds, and disinfecting any surfaces where you might have brought potential virus into your home. So how long is this going to last? I think that's a question on everyone's mind, and frankly, it depends. So the spread of disease slows down for various reasons. It can be related to seasonal conditions like the increase of the common flu during cold weather, or it can have to do with the amount of people in the community who are susceptible to that disease. So vaccines create antibodies in a person so that when they are exposed to a disease, the body already has defense mechanisms in place to stop the disease from infecting them. When enough people have the antibodies to a disease, the disease can no longer be easily transmitted. So this is essentially how we eradicated smallpox. Or if you want to learn more about this, you could play the game Pandemic, because that's basically how you win. But keep in mind, some people can't get vaccines. So some people actually have a negative reaction to vaccines, which can cause serious consequences, such as Guillain-Barré syndrome, which can actually cause temporary paralysis. So these people have to rely on the development of enough immunity within a community so that the disease can't be easily transmitted to them. And this is what is called herd immunity. So how do you achieve herd immunity for COVID-19? So there's two ways that you can do this. The first, as I mentioned, is to vaccinate people. Unfortunately, a vaccine can take at least a year, and it's more likely to be closer to 2 years before it can actually be available. The second option, frankly, is to let people get sick. This sounds really bad, but for other types of coronaviruses, once you have been sick, the body produces antibodies, which then either prevent it from getting the disease again, like chickenpox or dengue fever, or it allows the body to only experience much more mild symptoms on a secondary infection. So how long will it take to create this herd immunity? Well, if we had let the disease spread unchecked, estimates were that 80% of the world's population would have been exposed to COVID-19 by August of 2020. But we don't have enough medical care available around the world to treat that many people when they get sick. So we've put in these different strategies like lockdowns and social distancing to slow the spread or, flatten the curve to allow a slower rate of infection. Even with these strategies in place, though, many hospital systems are still over their capacity to care for people, especially those who require intensive care. And despite the best medical care, many people have died. So people have continued to get sick, even if at a slower rate, and hopefully we're reaching the peak of this soon. So what's going to happen after the peak? Well, there's good news and there's bad news. The good news is that once the rates of infection drop to a level that can be traced and monitored, many of these social distancing measures that we're seeing can be eased up. So we might in the UK, for example, see mandatory lockdown eased up to some of those general social distancing measures, maybe even as early as May. But that might only last a couple of months. Because without herd immunity or a vaccine, once people begin to have contact with each other, the disease is going to start to spread again. So once the rates of infection start to increase again, governments will likely do what they did in the first round, which is to put stricter measures back into place. And then the process begins all over again. So if the government does nothing during the second wave of infections, it could actually be even higher the number of people infected than in the first wave. So it's pretty critical that they do something again once infection rates start to go up. We may continue to see this pattern with windows of stricter social distancing when infection rates increase, and then windows of these less strict measures when infection decreases, possibly continued until early next year. Alternatively, a better scenario would be something like what South Korea has been able to achieve. So they've been able to reduce infections down to a small enough number that they can use tried and true epidemiological approaches to trace the disease. So when you're able to do what's called contact tracing, that means you identify a sick person and then you find all the people that sick person has come into contact with. And then only that group of people that have been exposed to the disease have to self-isolate. And then the rest of society can function close to normal. The issue with this is that it requires a lot of capacity that many public health systems don't have. So you need enough public health professionals to do this rigorous tracing. And in countries like the US, where public health budgets have been slashed, this can be really difficult. Technology might be also really useful for this. So I've seen some prototypes for apps being developed that can help to do that kind of contact tracing. Additionally, in order to achieve this approach, you need more testing. So because COVID-19 can cause people to be asymptomatic, meaning they don't show any symptoms even though they themselves are still infectious, it's important to test everyone, not just the people that are sick. For this reason, you need to roll out mass testing of antigen testing. So an antigen test would show whether or not you are currently sick, But then you'd also need to do antibody testing to determine whether or not people had ever had the disease, and then whether or not they might already have immunity to it. So to move to this type of long-term strategy, governments would need a strong public health system supported by more types of testing, more testing in general, but both antigen and antibody testing, and possibly some of these new technologies like these apps that can help do that contact tracing. So what should I do if I get sick or you get sick? Well, all governments have released guidance on what to do if you are sick. Most guidance is very similar, but I'm just going to share what the UK government has said. So 1, if you develop any symptoms that include either a high temperature or a new continuous cough, you should stay home until all your symptoms have ended, or for a minimum of 7 days. If your symptoms worsen, you should call the NHS services, or in the US, you might be able to call your primary care provider, and they will tell you whether or not you should go to a hospital. You should always call. You should never show up to a doctor's office if you have symptoms. If you have serious life-threatening symptoms, you should call emergency services. Research from the University of Edinburgh has also found that using nasal irrigation, something like a neti pot, or gargling with salt water can help to lessen the severity of symptoms as well. So to end with, you tell me what other information would be helpful. I mean, I hope you found what I've shared so far to be helpful, and I'd love it if you would comment or message me and let me know if there's something that you're looking for specific information on, like wearing a mask, or more information about the peak. Also, if you have other information that's fact-based, not just based on what you're hearing or rumors, or if you have data that contradicts anything that I've shared, please share that as well. Like I said, this is all based on information that I'm finding and reading, and I'm sure I've missed a lot of stuff out there. So, let's start a conversation about it. Stay safe, stay sane, and hopefully we'll see each other on the flip side.